Coming up next on CaribNation Health, we will be talking about telehealth. Telehealth is a growing means of access to healthcare globally. Today, I am joined by Mr. Mohamed Kamara, founder and CEO of InovCares, a telehealth company that provides culturally sensitive health care for women's health all over the world. That's what's up next on CaribNation Health. Welcome everyone to CaribNation TV Health. We are very excited to talk to our next esteemed professional in the telemedicine field of healthcare. And we are speaking to Mohamed Kamara. Mohamed Kamara is of InovCares, and he has an amazing platform which helps women with their general OBGYN or gynecological health. And I really want him to explain that. How did he get into that? Mr. Kamara, thank you for coming. Thank you for welcoming. I'm so excited that you're here and welcome you to CaribNation TV. You are in Dallas, Texas, as you said, right? Yes, wonderful. And you know, our viewers in the Caribbean are very excited about telehealth. I think everyone in the world has been excited that we had that entity, and we, especially during the pandemic, COVID-19, how were we to get to our providers, our doctors, our nurses, our mental health care professionals? And what I would like to know is that how you got into telehealth, and what exactly do you do in that stream?
Sure. Again, thanks for inviting me, Dr. Sindass, to have this conversation. I'll introduce myself. So, founder of InovCares, as Dr. Sindass said, and what we do, we connect women of color to culturally sensitive providers via telehealth and remote monitoring. And I got into it because of my sister and my aunt who passed away in childbirth. My sister died of pregnancy hemorrhage in Sierra Leone, which is in West Africa. And then my aunt died of preeclampsia in Columbus, Ohio. And so those two tragic deaths led to the forming of the company to really improve care delivery for moms as they go through that preconception all the way to postpartum. So really following them through their journey after delivery is very important as well, because that's where you start noticing the blues, i.e. Postpartum depression and other conditions that affect those patients is very important for us as well. And speaking generally, telehealth, we launched the company officially back in 2020 in April. Before we had a web app that then transferred to a mobile app, and we then started adding more resources into our telehealth offerings. It is not just a video consultation or scheduling. It's a video consultation, also text message consultation in the app. There's a component of the app where it's a peer-to-peer support. So that becomes very critical as well to encourage your users to stay healthy throughout their pregnancy, so that we can reduce a lot of those cardiovascular conditions that affect those moms. So they engage in that peer-to-peer support. And even in the case of addiction medicine, it becomes very important as well, that peer-to-peer support. So it's components that's there. And then there's a section called health assessments. And that section itself, it heavily involves collecting a lot of social determinants of health data. We also collect mental health data. We use DAS-21 on the back end. And then a lot of biometric data that involves their corrected BMI, the risk factors if they have diabetes, any conditions like preeclampsia we show as well. And then we then give that, and then there's nutritional guidance in that report as well. It's self-generated by the patients, and then it's shared with the OB-GYN during their consultation. We also now then also include a lot of remote monitoring tools too. So now patients can be at home, moms can be at home. Like in the case of the Caribbean, they can be at home in a remote area in the Caribbean, say in Jamaica, in Kingston per se, anywhere that's very remote. They can be able to conduct an ultrasound now instead of coming into the office. And so this is in the second trimester, we send an ultrasound to the patient's home, and as well as blood pressure monitor, glucometer, and then pulse oximeter. This is the ultrasound that we send. And so here they can actually apply the gel. There's a phone that goes with the ultrasound as well. So we're doing a whole lot of addressing, i.e., make sure that things can be done at home for the patients before they get into the office in the second trimester, so we can capture a lot of this condition. So this is how it'll go.
Oh, that's amazing.
The ultrasound actually happens. But that's high level when it comes to applying this in the Caribbean, in remote areas in the Caribbean, how telehealth and remote monitoring can improve care delivery.
Oh, that's amazing. I didn't even think about that, but I didn't know this really touched me what you just said, because I went through preeclampsia. I missed 8 months of medical school, had to stop, go on bed rest. And I was monitored just for my blood pressure. They had me on a monitor, but there was no video. There was more of a telephone call, and they would get a signal. And I mean, this is light years ahead. I mean, my daughter's 27 now. And I made it through that pregnancy, still another 3 months before I even went back to school. And my new baby went to live in Trinidad with my mom. And those were the miracles that allowed me to make it to become a doctor. But this extra factor there that you just showed me, this ultrasound in their hand, I mean, it was so hard. I couldn't move. The blood pressure would just go sky high. So if you could still be on bed rest in the comfort of your home, and then have this monitor, and it looks like it's fairly, like, not too expensive. How much? I mean, how do you get all this?
Yeah, and then there's this is the blood pressure that we send to the patient's home as well. So you can be at home doing your blood pressure and share that image, those results directly into the app as well. So you can be monitored at home, so you don't have to come into the office. And while the data is being transmitted into the app while you're doing your consultation, so you can be on.
Also, at this point, who is paying for these things? How do people afford it if they don't have means? And is that something that's being worked on?
Yeah, so for us, at least in the US case, going to the Caribbean and other countries, in the US case, we partner up with insurance payers. So the insurance payer actually cover all that. And we then offer it to the patients for free.
Oh, wonderful. And in terms of the Caribbean that you know of, do you know, are they working on that type of a grant situation? Select patients that have very, very high risk? How are they going to, or have you heard that they're going to be working on that?
So I was at a conference, an international telemedicine conference recently. I went to Montego Bay, Jamaica, sharing this and some of our results. And then we, in there was a clinician that was the dean of University of West Indies, and she was sharing some of the clinical study that they're doing, using partly sometimes telehealth, but as well as fortunately some physical form as well, in calculating BMI. And so they were stunned by the fact that we can actually calculate your BMI at home, your corrected BMI, using body imaging and AI, machine learning.
That is amazing. I mean, BMI, for my audience, you need the height and you need
Mhm.
the weight of a person and their age. So when you put those things together based on the age of the person or child, you can determine if they have a normal BMI, which is the body mass index, which tells you if you're obese, overweight, or normal weight based on standards.
Yes. And then the thing is, it's correct the BMI because it also include the inclusion criteria of the patient's the bio if they're African American, those demographic data as well. And then do predictions, i.e. things that you're supposed to be consuming as well.
Mm-hmm.
The food you're supposed to be consuming, the number of water intake and um, and nutritional intake as well. So it's a lot of rich data, and this can help. And she was like, she was wild by it because it was like this can. They've been doing this manually. If they have a
Mm-hmm.
solution like this can help her make her job a lot easier, and as well as help influence research.
That's amazing. That is amazing. So, for everyone out there, this is amazing work when doctors have data, when we can see if your body mass index, which is your weight compared to your height, is increasing. And we have data that shows us, well, I put you on a blood pressure medicine, but your blood pressure is increasing. Maybe it's the body mass index. So we have to, it'll tell us and help us know how to counsel you as patients when we have certain data. So when we say come in and follow up, that's why, right, Mr. Mohammed? We need data, and this is where telehealth, remote monitoring of patients can be amazing, so that you don't have to miss work. You can be at home. You can send the doctor the data. We know everybody has WhatsApp, so maybe we can use our phone, right, Mohammed? And that's the genius of telehealth. That is why we're moving forward. So moving forward in US, you said the insurance are paying for these the ultrasound and different things. Um, how does your company work exactly in the US? Is it local in one area? Is it spread out, or do you have like call center that is doing remote monitoring? How is your company doing this?
Yeah, it's a good question. So with collaboration with insurance payers, we then deploy in an area where either they don't have enough penetration or they're trying to break into that market. Um, in this case, we're bringing the solution to Dallas, right? And Dallas and Hidalgo County, mostly
Oh,
African American and Hispanic
mhm,
population in this
nice.
area. And so we then deployed, served those moms for 2 years and postpartum. This is where they get access to a doula, maternal care navigator, and a site liaison. And they
Mhm,
also, based on the report, even the report itself, the report shows a lot of social determinants of health, meaning that things that happen outside of the clinic, housing issues, if they have any personal safety issue, they need any any food insecurity, we partner up with local
mhm,
um, um, partners that do temporary housing for moms. We also partner up with partners that do like food banks, and there's also special funds that's allocated for those moms as well to address some of those social determinants of health needs. Um, so we look at serving the mom and having this integrative model
mhm.
where it's not just the healthcare provider, which is very important, but it's also things that are happening outside that causes challenges for that mom and their baby, so that she's only focused on herself and delivering and having this experience be a joyful experience as much as possible, and ensuring that we're capturing those risk factors very early on.
So it's amazing because, as we know, the risk factors, if you do not have a village, people to help drive you to your visits, you're on bed rest, who is bringing food in and what are they cooking? And so you're gathering all these data, and it's is it so far when you collect the data that is allowing you to get the insurance companies to pay at this point?
That's
And
correct. And then some of the insurance company have an incentive with RFPs that are out there that they get contract from the state, so they now have to show results, right? Or the government is going to take that money back that they give them, so they have to hire vendors like ourselves to
ah,
help them get results.
and then
uh,
oh yes, I love that because we need the data, and then once we have proof that it really helps bring out maybe less episodes of preeclampsia, actual healthy born babies, more of those, and that can thrive. It's just amazing because a child with developmental delay from prematurity, needing so many special needs services, which is awesomely hard to get in any country, that's amazing
and costly,
and costly,
right?
very costly, very
So
costly,
that's the from the insurance point of view.
definitely. And well,
Mhm.
everyone really, because we people think, oh, I can't afford this
Mhm.
thing, and they just full stop, don't even go forward. When this is actually probably a lot cheaper for the patient. A lot of use of telehealth can be cheaper for the patient instead of taking three taxis or having to pay so and so to bring them, or they can't bring their daughter, so they can't come. Different cultural things, or they don't want to even see the doctor because they know they're going to put them on medicine. And but maybe if they're in the comfort of their home, they might listen because the aunt and uncle might be in the background and say, well, why don't you listen to the doctor? I agree with what they said. I heard everything. So, and that's my experience actually with telehealth. A lot of players come into the window, the
Mhm.
video screen, and give their 2 cents. No, they're not doing that. They're really eating bread 3 meals a day, and they're not telling the truth. So it's very interesting, and I think telehealth is really amazing. Can you go back to the conference when you were in the Caribbean? How did that would your model be um, copied, or are there other players who are going to be joining on with you or doing that type of research?
Yeah, that's a great question. So this is not my first time in trying to bring a solution, say even the Caribbean. Um, and then the conference itself was really rewarding because you see a lot of folks doing work, not just in the Caribbean, but other areas as well. But for our case, we can definitely deploy this in the Caribbean. It's just making sure that who is going to help drive the
Mhm,
cost or man or
mhm,
pay for it, right?
mhm,
And bring
mhm,
this solution. But we can maybe it's not that we more monitoring tools that include maybe just the app, and we can
mhm.
deploy that because everyone has a cell phone in the
Yes,
Caribbean. Hell,
yes,
even the poorest portion or the portion that
yes.
can afford it, they have a cell phone because they can get on WhatsApp and talk their game.
Hmm.
Um, so
Definitely,
you gotta see,
definitely.
you got your cell phone.
WhatsApp is it right now.
Um, so definitely you have a cell phone and you can download this app both on iOS and Android.
Mhm,
WhatsApp you have to download. It's an app that you have to download, right? And
mhm,
so if you can download WhatsApp, you can also download this app which has the ability for you to do your video consultation, talk to doctors, interact with your peers, do a peer-to-peer support. You can send medications to patients home as well. So
yeah,
we have a partnership with Mark Cuban's company, Cost Plus
mhm.
Drugs. We send medication, the cheapest medication you can search for, and then it prescribe, and then we send it to their home directly. So mail order.
Oh,
Mm-hmm.
like Amazon.
Fast, exactly. And fast, like take a step back here, but the first before the launch of InovCares, I actually spent some time in the DR. And we had moms that were experienced they were affected by the Zika virus. I partnered up with Project Hope and went out there and were providing medical resources in the remote areas, community health centers, and
Mhm,
then a classroom. So community health centers by specialty, in a big building, each person has offices, different specialties to support those serving those moms and serving their husbands as well. But for us, how we deploy, we actually had medications in a in a truck of about 2 or 3 hours to deliver those medication. And then we deploy the solution itself. Instead of asking the patient to come into the clinic, we set it up in a classroom so we can meet them where their needs are, right?
Where they are.
We had we set up all of this in a classroom, and we were able to take their weights. The nurses were helping taking their weights. I was at some point even I was helping them taking their weights, the child's their measurements, things that they will need. And then the nurses the nurses were and the doctors were prescribing medications there as well, and giving those to those patients, and food as well. So I've seen it deployed in more areas. You just got to be clever around it, and then add on to that telehealth. How telehealth becomes very critical as well when you have this volunteered clinicians that are forming like the US clinicians when they go, but how do you continue that relationship after they leave, right? Return back to the country. Telehealth becomes critical. Yes. Telehealth becomes super critical because so now you can actually continue that relationship with that clinician that want to continue to support those patients in the Caribbean. And then while partnering up with the locals as well, the local providers, and teaching them how this tool works so that they can use it too, right? And they're not replacing those clinicians, but they're collaborating.
Yes, that's the thing. And I don't think any clinician or physician or provider should think of this as competition, because this can actually bridge gaps in terms of specialty care. So if you're their main doctor in wherever in any village town, but you need that extra little advice, or maybe just a touch point for the patient from another level of specialty, or you need more testing that you can't get in your region and you can't get the patient to go there. So let's say you can have that little ultrasound. You can't get them to go do the test. And by the time they go, there's a huge something, growing and a whole nother ball of wax. But my point is, there's so much benefit to bringing the knowledge base to the primary provider who's really caring for the patients every day in their town, in the local area. And it actually brings more benefit of more positive outcomes. And so I think this is such an amazing thing that you're doing. Keep going. We are so proud of you with this agenda, because the data that you're compiling is going to allow everyone to say, yes, this can happen. This is the bottom line cost, and the variety of the cost levels for it. And everyone needs it.
And the thing is, we localize the solution, right? Super important. Dallas here, I'm not from Dallas. Same thing if I want to go to Montego Bay, we're launching Montego Bay, I'm going there. And then before I go there, I will identify which hospitals are in the area, which clinics in the area that we can partner up with. And then as well, what resources are in the area that we can partner up with. The locals that are already doing the work. Here in Dallas, for example, there's Viola House, which does temporary housing for the moms, right? And as well as provide other resources, baby diapers, all these other resources. They call them baby box. They have a shopping center as well, food center. And then there's a place called Community, Crossroad Community Services. That is a big warehouse with food. So moms can go in there, patients can go in there to shop for food. And so that's how we then think of social determinants of health, have all these partners in the app while we have that opportunity to navigator speaking on behalf of the patients and ensuring that they have all the support and resources. So we localize our solution. I have been here for 18 days. Monday will be 18 days, but I've been able to touch a lot of partners already, and that's just going to continue to grow.
Wonderful. Wonderful. Well, this has been an amazing discussion. I'm really excited where InovCares as an example of telehealth is going to go. And I believe that many others are going to come right around you, and many are going to be following you. And I'm so thankful that you came on CaribNation TV Health today to discuss this important issue of telehealth, telemedicine. It's only growing. It's not going anywhere. And it's only growing, and it's really needed for a lot of the outcomes that we would rather have for our patients.
and it's quite an impact, and I'll live with this.
Yeah.
So there was one of our very first patients. She was experiencing infertility, had an OB/GYN physician that was being highly dismissal of her need in
Oh.
Columbus, Ohio, and she wanted a second opinion. And she came to us. We connected her to a culturally competent OB/GYN physician, Dr. Allwoody, who actually lives in Waldorf, who has a practice in Waldorf, Maryland. The two of them spoke for 30 to 40 minutes. They told the treatment plan for her infertility. Also, they prescribed prenatal vitamins, nutrition, somatosome directly. Fast forward 3 months after she texted the physician that she's pregnant. Then 9 months after her son, John, alive and well. That's the impact that this sort of technology can have. And the son is 3 years old now, happy as ever. But that's the power. The physician is in Dallas. I mean, in Waldorf, and the patient is in Columbus, Ohio. That's Waldorf, Maryland, and how that they still were able to connect, and him being able to be a culturally competent clinician goes a long way because he was able to have a customized solution that fits the cultural needs of that patient, and then help her to be able to get pregnant and have a healthy baby.
I love that. And that they were on other parts of the US. And I would hope that the barriers for intercontinental as well as international telehealth will be broken down too. Because that is a big player. Sometimes you just need one or two certain types of specialties for one region when they have, everything else. And it's none in their country. So that's a big area that needs to be explored. And telehealth could really solve a lot of things when you can get someone of a certain specialty to move to a certain place. Again, we thank you so much. I'm so thankful for the cases and for this discussion on CaribNation Health. We'd love to have you back again. And much success to you. Thank you, Mohamed Kamara. Where can we find you? Where can we find you if you want to look at your company?
We're on Android or iOS. You can type in InovCares and download the app. It's called InovCares patients. So there's a patient side, and if you have doctors that you're already working with, they can also be able to download the physician app or the provider app, and be able to. It takes less than a minute for the patient to sign up and be able to start using the resources, and it takes provider 3 minutes to sign up and be approved to start serve their patients.
And you have a lot of patient education on your app.
Yes.
Wonderful.
Free patient
and it's free.
Free patient education that covers various topics, and Dr. Sindass is one of those. You hear her in sharing about pediatric as well. And so it's a different topic.
Thank you, Mr. Kamara, again for being on CaribNation TV Health.